The news arrived like a whisper at first, a strange illness in Rwanda, spreading quietly but swiftly. People were getting sick, some dying, and the fear began to grow. The culprit, a virus, one you might not have heard of before. Marburg, a deadly pathogen. It's a hemorrhagic fever virus, and it's causing serious concern among health officials and the public. In this essay, we'll delve into the world of Marburg. We'll uncover its origins, how it spreads, and the devastation it can cause. We'll explore the symptoms it causes, from fever and chills to severe bleeding. We'll also examine the ongoing efforts to combat this outbreak, including research and medical interventions, and discuss steps you can take to stay safe, such as practicing good hygiene and staying informed about public health advisories. Marburg virus. It sounds like something out of a science fiction novel, but it's all too real. This virus has caused numerous outbreaks with high fatality rates, making it a significant concern for global health. First identified in 1967, Marburg is a close relative of the infamous Ebola virus. Both belong to a family called filoviruses, which are known for their filamentous, thread-like appearance under the microscope. These viruses are notorious for their ability to cause severe, often fatal, hemorrhagic fevers, leading to internal and external bleeding. The initial outbreak occurred simultaneously in Marburg and Frankfurt, Germany, as well as in Belgrade, Serbia, causing widespread panic and confusion. Scientists traced the outbreak back to infected African green monkeys imported from Uganda, which were being used for research purposes. This discovery highlighted the risks associated with handling exotic animals and the need for stringent biosecurity measures. Marburg spreads through direct contact. This means coming into contact with the blood, bodily fluids, or tissues of an infected person or animal. It can also spread through contact with contaminated surfaces or materials, such as bedding or medical equipment. Early on, many healthcare workers were infected while treating Marburg patients. This highlighted the importance of strict infection control measures. Section 4. Recognizing the signs, symptoms of Marburg. Understanding the symptoms is crucial for early detection and treatment. Marburg announces itself suddenly, like a thief in the night. It strikes without warning, leaving the person feeling abruptly ill. The early symptoms mimic other common illnesses: fever, chills, headache, and muscle aches. These initial signs can easily be mistaken for the flu or malaria, but as the virus takes hold, the situation turns grim. Severe diarrhea, abdominal pain, and vomiting set in, making it clear that this is no ordinary illness. Some patients develop a rash, which can be a telltale sign of the infection progressing. In severe cases, Marburg causes bleeding from the nose, a symptom that is both alarming and dangerous, gums, and other orifices. This bleeding can be profuse and difficult to control. This bleeding, a hallmark of hemorrhagic fevers, is a critical indicator of the disease's severity. It is often a harbinger of organ failure and death. Immediate medical attention is essential to manage these severe symptoms and improve the chances of survival. Section 5. Fighting back containment and treatment. There is no cure for Marburg, but early supportive care can improve the odds of survival. This includes maintaining hydration, managing symptoms, and providing oxygen and blood transfusions as needed. The focus is on stopping the virus from spreading. Healthcare workers are on high alert, tracing contacts of infected individuals and isolating them to prevent further transmission. Experimental treatments like antiviral drugs and antibody therapies are being explored, offering a glimmer of hope.